Abortion. Is it morally right or wrong? Debate group. Chandni Barnabas, Reagan Hargrove, and Mackenzie Matthews. Chandni Barnabas, responsible for creating, formatting slides, 6 slides for abortion, sources, definition, minority and majority slides with illustrations. Reagan Hargrove, responsible for creating, formatting slides, 6 slides against abortion, and sources. Mackenzie Matthews, responsible for creating and formatting slides, 2 slides on King and Nietzsche readings, embedding them with abortion, sources, and PowerPoint voiceover with YouTube video. What is an abortion? Abortion is terminating a pregnancy by removing the embryo or fetus from the uterus before it is fully developed. One of the main considerations taken into account is the health and safety of the patient when trying to get this medical procedure done. Should abortion be legalized? The minority viewpoint of our group stands for abortion not to be legalized due to the harmful after effects from this procedure, as myself, Chandni Barnabas, for the reasons of complications, religious sin of feticide, and mental health issues associated. One of the main causes of being against abortion is the killing of the fetus, which is a life being developed, and relating it with a religion to be considered a homicide known as a sin. Abortion shouldn't be legalized because it leads to further health complications down the road, causing the women to be sterile and not being able to conceive again, possibly in the future from this devastating procedure. Abortion can also lead to physical, psychological, and spiritual pain in terms of guilt and burden. Pro-life, morality. Abortion directly contradicts the morals of most people. The ending of a life in itself is morally wrong, but especially for an unborn child who the pregnant mother is supposed to protect. The abortion rate is between 30 and 40%, either deliberately or unintentionally. Procedural complications. There are several serious complications that can happen during an abortion. Some of those complications are the abortion just doesn't work and the pregnancy doesn't end. Injury to non-reproductive organs. Some of the pregnancy tissue is left in your uterus. Scar tissue on the uterine walls. Blood clots in your uterus. Very heavy bleeding. Infection. Injury to your cervix. Allergic reaction to medication, and perforation of the uterus. Physical long-term complications. Abortions are a very invasive procedure that can come with long-term complications. Some of those complications are increased risk of pelvic inflammatory disease and infertility. Abortions can also increase risks with future pregnancies. A few risks are ectopic pregnancy, spontaneous abortion and stillbirth, complications of pregnancy, preterm birth, small for gestational age, and low birth weight. Mental health complications. Having an abortion is a very emotional process. This can lead to short and long-term mental health issues. A few of these complications are depression, anxiety, post-traumatic flashbacks, feelings of isolation, anger, guilt, shame, and possible suicide ideation. Religion. In many religions, abortions are not allowed. It is also believed in many religions that life starts at conception. Inadequate medical training. With the abortion ban, several, if not all resident doctors will miss out on the proper training for this procedure, leading to inadequate training for future patients. Why should abortion be legalized? The majority viewpoint of our group stands for abortion should be legalized since it's the female's body and she has the right to treat it accordingly to her wishes. With the elective surgery of abortion, the group members are Reagan Hargrove and Mackenzie Matthews. Medical conditions of the abnormal development of the fetus or embryo cause to a female to undergo an abortion. Financial instabilities and unacceptance from a significant other may lead to the termination of pregnancy since the couple aren't ready to start a family. Skipping contraceptive pills or not having enough sexual knowledge becomes the barrier of unwanted pregnancies requiring abortion. Health conditions and timing of psychological, physiological changes requiring treatment to save the patient first rather than carrying the wanted pregnancy leading for abortion. My body, my choice, my right. Abortion rates have decreased with increased awareness of education and usage of advanced technology through the use of contraceptive pills and other non-invasive methods. The famous Supreme Court case of Roe v. Wade in 1973 in Texas ruled against act of prohibiting abortion considered as unconstitutional. When married or unmarried couple have an unwanted pregnancy with financial crisis, they mutually come to a decision to terminate pregnancy. Support groups of family and friends when this decision is made. Medical tests, procedures, and amniocentesis of lab work are resulted with negative aspect to continue the pregnancy, where the pregnant woman is given the choice to keep or do the safe abortion due to clinical complications. Overall, the physical, psychological, financial, and emotional health are a big part of consideration when making a decision to bring the new life to this world or doing an abortion to reduce other stressors and circumstances to face. Abortion with safety. It's an important part of a woman's OB/GYN care. Medical procedure needs to take place at a hygienic medical clinic or hospital due to complications of infection, leading to further sepsis if instruments or process is not done in a sterile, aseptic technique manner. Complications vary based on medical or surgical abortion procedure. One of the major complications leading to further infection or sepsis is after an abortion if the pieces from the embryo or fetus still remain in the womb. Abortion is to be done safely by medical professionals using hygienic equipment rather than performing unsanitary procedure from an inexperienced personnel. Women will become immediately fertile after an abortion, so it is advised to use contraceptives to avoid pregnancy. Medical conditions leading to abortion. One of the main reasons or causes provided by the healthcare provider is that they're in underdevelopment of the fetus and not growing as expected. There is a serious genetic or structural deformity. Pregnancy complication leading a risk to one's own life and health. Diagnostic or screening tests requiring immediate abortion due to severe health complication or risks. Fetal anomalies, birth defects, chronic illness, or stillbirth. Abortion to take place with choice before 24 weeks of gestation of pregnancy. Necessity for an abortion. Being a minor or underage. Health conditions of preeclampsia, fetal anomalies, and chance of ectopic pregnancy. Undetermined marital status. No financial support. Lack of education and awareness. Personal family, social, or economic factors. Psychologically unprepared for having a baby, rape case by incest stranger, friend, or an unknown person. Finances and psychological health opting for abortion decision. One of the main reasons for an abortion is not having a steady income with marital status, of being single and not married with no financial or family, friends, or group support. Mental health counseling to cope with any guilt or burden to do an abortion either voluntarily or involuntarily due to health crisis, financial instability, and lack of family or friend support. Impediment of education, career, social or sex life, and maintaining relationships. Health and safety concerns due to complex complications with low-income finances. Unable to provide a good life due to bad timing of occurrence of pregnancy. Interference of future plans, or not prepared physically, mentally, emotionally, or financially. Gender discrimination leading to abortion by Hindu believers. In Hindu culture, when a pregnant female is known to carrying a baby, an ultrasound is performed to check the gender, and if it's a female, either voluntarily or involuntarily, an abortion is performed due to male-dominant and patriarchy society beliefs. Gender inequalities with male babies preferred and female feticide. Female baby feticide abortion is performed due to socioeconomic beliefs of when she grows up, the family is bestowed to pay dowry to the groom and will lead to poverty. 1 million baby females and more are being aborted annually due to family burdens of financial status. Advanced technology has been misused to identify gender from pregnancy tests ultrasounds, and other medical tests or procedures, which caused many families to vote for female baby abortion. This method of female feticide was very common in India for quite some time, but now it's become a criminal offense and are banned to have sex determination in India to stop these unnecessary abortions. Principles relating to abortion from the Letter from Birmingham Jail by Martin Luther King Jr. Arguments in support of abortion can be made in the vein of Martin Luther King Jr.'s letter from Birmingham Jail, citing concerns for social justice and individual liberty. The importance of civil rights and the struggle against unfair laws and systems are emphasized in King's message. In the same vein, honoring an individual's agency and autonomy over their own body means endorsing their right to an abortion. It recognizes that in circumstances of rape, incest, or when the individual's health is in jeopardy, the person should not be coerced into becoming pregnant or parents against their will. Denying people the right to a safe and legal abortion feeds injustice and inequality, especially to underprivileged communities where access to other options and resources may be limited. Respecting the right to an abortion is consistent with Dr. King's beliefs about justice and the struggle against repressive structures that impose limitations on individual freedom. Principles relating to abortion from Beyond Good and Evil by Friedrich Nietzsche. On the other hand, by emphasizing the intricacies of morality and the idea of the will to power, Friedrich Nietzsche's Beyond Good and Evil might offer a defense against abortion. Nietzsche urges a reevaluation of what is deemed good or evil and questions established moral principles. From this angle, it is possible to claim that abortion is a morally complex decision that defies accepted standards. Some people might argue that abortion raises moral concerns regarding the worth of life and the exercise of power over it, because it involves the termination of a potential existence. While Nietzsche's philosophy places a strong emphasis on the individual's will to power and the necessity of challenging conventional morality, it also acknowledges that people must consider the moral implications of their decisions, particularly those pertaining to abortion.